Hello everyone, my name is Shohre. Today we are here with the most experienced, knowledgeable, caring gynecologist in Los Angeles, Dr. Arjang Naim. Hi Dr. Naim.
Good to see you.
Good to see you too and great to have you here, Doctor. Dr. Naim, thank you first, and I have selected some questions from your comment on social media. Let me go over that, okay? Thank you. Someone asked you about when is necessary to see gynecologist for the first time, doctor?
Yeah, so a lot of patients, a lot of women ask me this question, when is the best time to go or for the first time? It's recommended to have a checkup at 21 years old, but a lot of people usually wait till they are sexually active. If you're sexually active younger than that, then you probably should go see your OB/GYN doctor to be checked, check for infections, or also as far as family planning, birth control. But usually 21 years is the time that I recommend to patients.
Thank you. So people ask about some questions about the pregnancy.
Yes.
She asked, what's the best birth control option, doctor?
Yeah, so for a patient to try the best options, it depends on what the patient wants or what is easiest for them. Some people don't mind taking pills every day. Some people forget about that, so we want something that just, replace and not to have to worry about it. Something like an injection maybe. We have something called an Nexplanon rod. It's good for 3 years. We have long-term birth control like IUD. All of them do have some side effects, such as weight gain, such as not having a period. Some patients don't mind not having a period or actually prefer not have a period. For those patients, we recommend something like an IUD or an injection or Nexplanon, which is long-term. But most patients who is the first time starting, usually we try to use the low-dose birth control with the least side effects.
Thank you. Actually, you asked most of the questions. Okay, I'm going to factor them. And let me ask one of the most popular questions. Is sex during pregnancy safe?
Yeah, so during pregnancy, in general, having a relationship is okay, it's safe. Unless somebody's high-risk pregnancy, such as history of preterm labor or bleeding. In those patients, we do not recommend to having a relationship while pregnant. But for somebody who has a normal pregnancy, no high risk, is not a problem. It gets a little harder when the pregnancy progresses at the end. So you have to try different positions to be more comfortable. But there is no proof that it causes any harm or any chance of preterm delivery just to have a relationship.
Thank you. So someone asked about how does birth control affect fertility?
Yeah, so the birth controls are made to stop somebody from getting pregnant, but there's two main way of working. Things like pills, they affect the body so the patient doesn't ovulate. So the birth control pill, for example, or also some certain patches and rings tricks the body the way that you don't have any eggs coming, and that way you won't get pregnant. And that's why we also use it for things like ovarian cyst, because some people, when they ovulate, a cyst forms and can give them some problem or pain. But another kind of birth control works by affecting the uterine lining. For example, the progesterone birth control methods, for example, injection or certain IUDs, they affect the lining of the uterus by the progesterone. Also, they affect the mucus of the cervix. Therefore, the sperm has a problem going inside the uterus. Another kind is a copper IUD, which is the copper is actually toxic to the sperm, and by the fact that we use a copper IUD has no hormone that also stops the sperm from going inside, and that's how it affects as far as birth control.
Thank you, Dr. Naim. For the male and female, so what causes infertility in both?
Infertility is a very common problem that we see in the office. It's interesting that 1/3 of the infertility is usually from the male side, 1/3 from the female side, and 1/3 we don't even find out the reason after complete workup. In male, usually we see a lower sperm count or sperms that are not very good. For example, they have don't have good enough motility, not able to move around, and low sperm count because that could be due to low testosterone or other reasons. That's the main as far as the male side. As far as female side, we see occlusion of the tubes. that can be tested with a small, simple test called HSG. There is also lack of ovulation due to hormonal imbalance. It could be older age that causes not a very good quality eggs. These are the main reasons for the female infertility. But I should say that a lot of times we do the workup that male has a normal sperm, female has ovulation and good quality eggs, but it still have issues. That's why we go things such as IUI, which stands for intrauterine insemination, or IVF is necessary, in vitro fertilization, which will be the next steps after that.
Thank you for notice about IUI because we have a lot of questions about that. Thank you. How is polycystic ovary syndrome diagnosed?
Yeah, polycystic ovarian syndrome is a very common syndrome that we see in patients, usually younger patients. There are three signs for this. One is irregular periods. The other one is hirsutism or extra hair on the body or acne. And the third one is having multiple ovarian cysts. So if you have two of these, usually they diagnose it as polycystic ovarian disease. There are different treatments for this, things like birth control, things like anti-testosterone medications, like such as spironolactone. Also, there are medicines that decrease the insulin level in the body and has shown to decrease all the symptoms and help with fertility, because a lot of these patients have problems with getting pregnant, and these will help them.
Right. So you talked about birth control. We have a lot of questions. The most important question for the women is, will the birth control pill make the people gain weight?
Yes, some of the birth control, especially the
be honest about it.
Especially the older ones, the one like from the long time ago, they have a higher dose of estrogen progesterone, and these estrogen progesterone do cause weight gain. A lot of them cause water gain, so a lot of patients feel like they're getting heavy weight. Some of them increase appetite, so you eat more. So they do that. But the newer one have a very low very low hormone doses. So I would say that you don't see any of those symptoms, any of the side effects on the low dose ones. Progesterone mainly causes increased appetite and water gain. So the progesterone injections such as the Provera do have those side effects. But again, the non-hormonal IUDs don't have any side effects such as that. And also the lower dose birth control don't have these side effects.
Dr. Naim, questions about the pap smear. What does a routine pap smear show, Dr. Naim, and what other tests should I ask for?
Yeah, so a routine pap smear is a test for cervical cancer. Many patients get confused and think that a pap smear diagnosis for uterine cancer and ovarian cancer, which does not do that. Pap smear is only test for cervical cancer, which is the opening of the uterus. If somebody is concerned about uterine cancer because of, for example, irregular bleeding, then you need a biopsy of a uterus. Somebody is worried about ovarian cancer, you have to ultrasound and other tests to diagnose for that. So pap smear only diagnosis with for the cervical cancer. Depending on age and the risk factor, need to be done every year or up to every 3 years. We also add something called HPV test to it because HPV shows if the woman is being exposed to the virus or not, and almost 95% of cervical cancer are for people who have HPV on the cervix. So we all check for that. If you don't have HPV, the risk of having a cervical cancer is much lower. If you're positive, it's much higher, and you have to have closer follow-up. Besides the pap smear, we recommend or patient asks for check for STDs like gonorrhea and chlamydia, and also sometimes you do ultrasound as part of the routine exam to check for ovarian cysts or any tumors that the patient might or might not have.
Thank you, Dr. Naim, for all your information. Thank you. Follow this page and leave your questions on social media, and we're gonna back with your answers. See you.